Acute heart failure. It's a terrifying, life-threatening medical emergency. When first responders show up, they have one main goal and a few really powerful tools to manage the crisis. In this explainer, we're going to break down what's actually happening to the heart and how these treatments work to, well, pull a patient back from the brink. So, let's get into it. It all really boils down to this one simple question. When the heart, the body's most important pump, just suddenly can't do its job anymore, it sets off this dangerous chain reaction. And that right there is the crisis of acute heart failure.
Okay, so before we can even talk about the treatment, we've got to really understand the problem. And at its core, what we're talking about is a heart that is just completely, totally overwhelmed.
So what is heart failure? Well, it's a clinical syndrome where the pump itself just isn't working right. Now, a lot of times, this is a chronic thing. But an acute crisis can be set off by something as simple as eating too much salt or fluid, or something major like a heart attack. But whatever the cause, the result is the same. The whole system starts backing up.
And this is where things get really, really dangerous. That fluid backup doesn't just stay in the heart, it gets pushed back into the lungs. That's a condition called pulmonary edema. And for the patient, it feels like they are literally drowning from the inside. They're going to be incredibly short of breath, and they often can't lie down flat, because that just makes it even harder to breathe.
So how do you possibly fix this? Well, the goal isn't to force that failing heart to pump harder. That would be like whipping an exhausted horse, right? No, the actual goal is way more elegant. You just make the heart's job easier. It's all about lightening that workload.
And to do that, you've got to understand two really important concepts, preload and afterload. I love the analogy here. Think of preload as all the blood coming back to the heart. It's the volume of water flowing into a pump. Afterload, on the other hand, is the resistance the heart has to push against, like a kink in the garden hose. In acute heart failure, both of these are way, way too high.
So the first tool paramedics reach for is a medication called nitroglycerin. It's a powerful vasodilator, which is really just a fancy way of saying it makes your blood vessels wider.
And this is the brilliant chain reaction that happens. By opening up the veins, nitroglycerin basically lets blood pool in the rest of the body instead of all rushing back to the heart. This directly lowers the preload, the amount of blood the heart has to deal with. And with less blood to pump, the heart's workload just plummets, and that awful pressure backing up into the lungs starts to go away.
So the big takeaway here is that nitroglycerin's main job is cutting down that preload. But what's really cool is that at higher doses, it also opens up the arteries, which reduces the afterload. It helps unkink the hose. This 1-2 punch is what so quickly relieves that congestion in the lungs, and, as a huge bonus, it lowers the heart's own need for oxygen.
But hey, it's not all about medication. Paramedics have another tool that works just beautifully with nitro. It's called CPAP, which stands for Continuous Positive Airway Pressure.
Now, you've probably heard of CPAP for things like sleep apnea, but in an emergency like this, it is an absolute game changer. A mask delivers this constant stream of pressurized air, and that helps in two ways right away. First, it physically props open those struggling airways. And second, that pressure is literally pushing fluid out of the lungs' little air sacs and back into the bloodstream where it belongs.
But here's the really elegant part. CPAP isn't just for the lungs. That same positive pressure inside the chest actually makes it easier for the heart to pump blood out. In other words, it directly reduces the afterload. So you've got this one treatment that's hitting the problem from the breathing side and the heart side. It's an amazing 2-for-1 solution.
Now, as amazing as these treatments are, they are also incredibly powerful. And that means paramedics have to be extremely careful. They need to know exactly when to use them and, maybe even more importantly, when not to.
So let's just walk through the biggest risks here. With nitroglycerin, the number one worry is the patient's blood pressure dropping too low. And that's a huge risk if they've recently taken erectile dysfunction meds, or if they're having a very specific kind of heart attack, a right-sided MI, where the heart actually depends on that high preload to work. If you take that away, their pressure can just bottom out. For CPAP, it's more about the patient's condition. You just can't use it on someone who's in shock, throwing up, or isn't awake enough to protect their own airway. The risk of forcing stuff into their lungs is just way too high.
And that brings us right back around to the main idea, doesn't it? Everything we've talked about, nitroglycerin hitting the preload, CPAP hitting the afterload and helping the lungs, it all serves this one single, elegant goal: reduce the heart's workload so it has a chance to catch its breath and recover.
So, we've seen how first responders can so skillfully manage this crisis, using this combination of drugs and mechanics to ease the heart's burden. But that leaves us with an even bigger question, right? These tools are great for managing the crisis, but what makes a heart fail in the first place? Well, that's a story for another explainer.